Doesn't matter. What we have, we'll start, right? To start कर दे बेटा, फिर सूख रहा है. तुम्हें organon बता लाया चल. Hello participant, have you brought organon of medicine?
Yes, sir.
Okay. You should have also Kent's Materia Medica also. Then Tyler. We'll talk something about Tyler. We'll talk something about Boric, then Allen's. We'll start with OA Julian. We'll read something about NASH. It is 10:41. Shall we start, Nitin?
हाँ सर, स्टार्ट कर दो.
So we'll share my screen. Achha. Can you allow me to share?
हाँ सर, एक मिनट.
With ये करेंगे. You are the host now.
सर अभी स्क्रीन शेयर हो जाएगी.
Okay. स्क्रीन शेयर हो रहा है, देखो तो. स्क्रीन शेयर हो रहा है. Comfortable? Good morning to all of you. Hope you are all fine on Sunday morning. Today we'll discuss a lot of Materia Medica books which are not read nowadays. The books which we used to read in our olden days. I think beta light on kar den made. Yeah, thank you. अभी बेटा त्याज भी बद्दी चालू करते लाइट. All lights should be light desire for, right? Okay, done. We'll start with a very nice aphorism from Organon of Medicine, aphorism 153, which says, in this search for a homeopathic specific remedy, that is to say, in this comparison of collective symptom of the natural disease with the list of symptoms of known medicine in order to find among this an artificial morbific agent correspondent by similarity to the disease to be cured. The most striking, singular, uncommon and peculiar characteristic signs and symptoms of the case of disease are chiefly and most solely to be kept in mind view, for it is more particularly this, that very similar ones in the list of symptoms of the selected medicine must correspond in order to constitute it the most suitable for effecting cure. The more general and undefined symptom like loss of appetite, headache, debility, restless sleep, discomfort, and so forth demand but little attention when of that vague and indefinite character, if they cannot be more accurately described as symptoms of such a general nature, are observed in almost every disease and for almost every drug. Clear? So aphorism 150 says that we have to focus more on peculiar, rare, uncommon, right, symptoms of a patient. Common disease, we can see its own symptoms of the patient. For example, diarrhea, vomiting, these are all common symptoms. So what characterizes a patient is uncommon. What is uncommon in a patient? We can start with how he has come to the clinic. It starts by taking appointment also. Gusseti appointment le che, no? How he talks, how he comes inside the clinic, whether he is in a hurry, how he is sitting, whether she is sitting with a cross leg, whether she is standing, whether she is very hurried way coming to the clinic. How is the look of the patient? There is a rubric called Grostek-Q. Grostek-Q. A peculiar sense of dressing, a rubric we can see in our Materia Medica or in the repertory. As today's topic is Materia Medica, we'll concentrate more on Materia Medica and then we'll jump to repertory and then organon. And we'll start with organon also. So 153 aphorism is very fundamental for our clinical understanding of any case. So what is common and what is uncommon, right? So we'll start with good book, NASH. So you can open your NASH, or those who don't have it, we'll study from this software. The software says, or the book says, NASH covers over 200 remedy. In order he thinks of them to follow the bend of my inclination, sometimes express the moving of the spirit, not in alphabetical sequence. This is very characteristic of NASH. Alphabetical order में फाटक नहीं लिखा है, रेपर्टरी में ABCD वाइज. ये मटेरिया मेडिका हम लोग पढ़ रहे हैं, तो अल्फाबेटिकल वाइज में नैश ने नहीं लिखा है. What he says in the preface of the book. This book gives some interesting insight into thought process of one of the great old homeopaths. The 6th edition was published as late as 1946. Jara Desh Azad bhi na to ena pehla published है, right? It is still in print in India. This description comes as a release book by Julian Winston. Now we'll read very interesting remedy. We'll open Kali Muir from NASH. Do you know Herring said about Kali Muir? It is a breech presentation. Why Herring has said about the breech presentation? Do you know what is breech presentation? Correct, right? So this remedy was born as a breech presentation, was written by Herring, or rather told by Herring. So we'll jump to the last paragraph of Kali muriaticum from NASH therapeutics. Are you visible? So we'll read last line. Kali mur is likely to come into use more than a clinical introduction than from proving. This is what Herring used to call a remedy born by breech presentation. It is possibly but not right or natural. Now, what is the use of Kali mur? So it says the clinical use in the potency ranging from 3rd to 30th had proven that a remedy for undoubted great value is used in the 2nd stage of inflammation or the stage of interstitial exudation in any part of the body. Now this Kali mur has very interesting mind symptom. So we'll open boric. Till now, remember Kali mur as a brief presentation told by Herring. And now we are going to boric to read the mind of Kali mur. So boric materia medica, Kali mur. Are you able to see? Participant, online
Yes, sir.
participant. The first symptom which the boric says, imagine he must starve. This is very important of Kali muriaticum. Starving. There was a case where the patient used to collect many things. For example, food. He had this illusion or delusion in his mind that he will starve. So Kali muriaticum patient will start collecting things as they have in their mind that they will starve. This is the only mental symptom given in boric. We should know and we should remember, or we should apply in our cases. So underline this important symptom from boric materia medica. Now we'll go to very interesting remedy. Now I'll ask you one question, which is the remedy where you will treat or cure diabetes and sterility. Phosphorus, okay. Online participation.
Moscus.
It cures diabetes and sterility.
Coca moscus.
Coca moscus, good. Yes, offline. Phosphorus, okay. Any other remedy? Any other remedy?
Sir, Moscus.
Okay, I'll show from Kent. So open sulfuric acid from Kent's materia medica. Sulfuric acid. Acidum sulfuricum. So this is acidum sulfuricum. And what Kent's write? See, diabetes. It has cured diabetes. Are you able to see? It has cured diabetes. Now second symptom, sterility, right? Sterility. And you will see. It has cured sterility when it was supposed to depend upon the copious and frequent menstrual flow, violent itching of the vulva. Dear participant, are you able to see? If you have Kent's materia medica, please underline these two symptoms. Very important symptom from Kent's materia medica. It is the sulfuric acid combination of diabetes and sterility. The statement which Kent used, he has written cured. Cured symptom લખવું મતલબ Kent માટે બહુ જ important વસ્તુ છે. Now, can you tell me the drugs for uterine fibroid? Offline and online.
Aurum netronatum.
Aurum netronatum. Very good. Very good. I'll show you another remedy, new remedy. It is not a new remedy, but very efficient remedy. Try this remedy in your practice, you will never fail. Any other idea for fibroid? Sorry? Thyroidinum, very good. Yes. So we'll type fibroid. The remedy is Tarantula hispanica. Very strange, no? As how can a spider can cure fibroid tumor? But it is written in Kent's Materia Medica. Very interesting. So we'll read what he writes. There is burning in the abdomen that extend down through the intestine, burning in the rectum, sharp pain in the spleen, the liver is painful to touch and is swollen. Pain in the both sides of the abdomen is distended with flatus, subject to much colic, shooting pain in the abdomen, anus and vagina at the same time. Women who have been poisoned by the tarantula were found to have fibroid tumors in the abdomen and uterus. Severe pain in the lower abdomen. Tarantula is excellent remedy for constipation in children, believe me, and it has cured. I have seen cases. See, why I'm showing this slides to you? Because I've cured cases and then I am telling it to you. It is my clinical experience which I'm sharing with you. Repertorization is a different thing and reading from Materia Medica is a different thing. There is a book called O.A. Julian where he writes, Materia Medica is bread earner for homeopaths. I can show you in that book. So we'll read constipation form Tarantula hispanica. It has cured most terrible and alarming constipation after catheterics and injection failed to effect a movement. The symptom that guides us to continual tossing. This is very important. Tossing, anxiety, restless, rolling from side to side and rubbing the head against the pillow. I had this patient, small child who was, when there was an urge for stool, he used to run, very restless, tossing about, and tarantula in 10 he got cured. There is no desire for stool. With the stool, there is much blood. In the rectum, there is pain, smarting, tenesmus, and in the abdomen, colic. Most difficult stool, it also has diarrhea with nausea, vomiting. Diarrhea has got on after washing the hairs attended with dark, pitted stool. And tarantula is known to cure diabetes also. So I am talking about two remedies, diabetes with sterility, sulfuric acid, and constipation, fibroid, and diabetes combination is there in Tarantula hispanica. So we'll read about diabetes. Sugar in the urine, and it has cured diabetes. Diabetes with grief, like acid phos. Anxiety, weakness, and bruise pain all throughout the body. There is involuntary urination when coughing. Very important in squilla, pulsatilla, causticum, natrum muriaticum. These are the drugs which has involuntary urination when coughing. Many pains in the kidney, most difficult urination. It has cured renal colic. It is wonderful remedy for renal colic. આપણે અત્યારે શું ખબર છે? Berberis vulgaris, Lycopodium. So tarantula is also the one of the drug for renal colic, dear students. Remember that. Okay. Now
આખા દિવસે બાર એક ગોળી તો ખાતો હોય છે
we'll
6
learn. Can you
12 ગોળીઓ જાય જ છે ને એટલીસ્ટ
can you tell me which is the remedy for the adenoids?
પછી પોતાના રીતે લેતો નથી
Which is the remedy
Tuberculinum.
for adenoids?
ફોસ્ફરસ
Hello.
Agrafis
Remedy for
newtans.
adenoids?
Agrafis newtans.
Tuberculinum.
Tuberculinum, Agrafis newtans. Agrafis has deafness, right? Are you right? Am I right? Okay. So we'll read adenoid from Tuberculinum, Kant's Mathematical. What he writes. So we'll go to adenoids. What Kant writes, very important, very, very important. If tuberculum bovinum be given in 10m, 50m and cm. See how he writes 10m, 50m, cm. આટલી બધી પોટેન્સી આપાતી હોય? ગાંડો માણસ છે ને? ના, બહુ એક્સપિરિયન્સ માણસ છે. My student knows how much potency I give, right? We are using 10m, we are using also 50m, we are using cm. I can show you the last cancer cases disappearing. Herpes got disappeared with 50m thuja. He was given 10m, 50m thuja. I have video also. So what he writes, if tuberculum bovinum be given in 10m, 50m, cm potencies, 2 doses of each potency. See how he writes. Yaad rakjo, 2 doses of each potency at long interval, or you can give consecutive. Somvare, Mangalware, Budhware. See, our vital force will not be stimulated if you give for a longer distance. You have to strike your vital force. It should be very consecutively. Successively you have to give. At all children and young people who have inherited tuberculosis. See what he writes about the inherited tuberculosis. May be immune from their inheritance and their resilience will be restored. Resilience will be restored. It cures most cases of adenoid and tuberculous glands of the neck. My God. Underline kari dejo, this will pay you like anything. Paisa vasool, this sentence. Atlu tame understand kari leso ne, many things you can solve in your patient. The patient should be of tubercular bovinum. Remember, symptoms matters. Now he writes about headache. The headache is tuberculum cures the most violent and most chronical periodical sick headache. Periodical is the tubercular symptom. Periodic means no vage mathu dukhe. It is similar to Sidron. No, Sidron-like phenomena. Lachesis has Sidron-like menses. Do you remember that? Lachesis, menses comes exactly on time. You should not prescribe lachesis if the menses comes irregular. It is always on time. And she feels much better after the flow. 3 remedies you should remember. First is lachesis, second is Valerina, and third is Zincum metallica. Okay. So we'll read about headache. Irregular periodicity coming under certain condition in a damp weather after overwork, from mental excitement, from overeating, disorder stomach. Tuberculum breaks up the tendency to chronicle periodical headache when the symptoms agree. My God, when the symptoms agree. Su lakhe che end ma? When the symptoms agree. If symptoms do not agree, don't give tuberculinum. એવું કહે છે. Now we'll go to very interesting use of a remedy called bacillin. What he writes about bacillin. It is common feature of tubercular affection of the brain. એના નીચે જ લખેલું છે. And of the meninges to suffer from constipation. Stool which are hard and large. Constipation alternating with diarrhea. It is well known clinical fact. Oh my God. This well known clinical fact. Constipation is strong feature of tuberculinum. Please understand, it is a tubercular feature. It is, if you see tubercular is sorosyphilitic. Constipation, stool hard, large and hard, nausea, inguinal gland indurated and visible, excessive sweat in chronic diarrhea. That symptoms was brought out by Burnett. See Burnett, the role of Burnett, which Kent also writes. Kent was never against Burnett. There are doctors who don't believe on theory about Burnett, but Burnett was also a very stalwart doctor. That symptom was brought out by Burnett. It was merely a clinical symptom. Burnett dwells on this phase. Tebes mesenteron. Believe me, children, you will get many mesenteric gland swelling if you go for sonography of the abdomen. The child will suffer from repeated colic. પેટમાં દુખે છે, પેટમાં દુખે છે, કેટલી બધી સોનોગ્રાફી કરાવી લીધી. એ સોનોગ્રાફીમાં એક જ વસ્તુ આવે છે, ગ્લેન્ડ સ્વેલિંગ છે. તમારા પાસે કોઈ દવા છે? આપણા પાસે છે કેન્ટ ભાઈ.
वॉल्यूम कम करना पढ़ाई जाती है यार.
सॉरी, हेलो, are you understanding what I'm saying? Tebes mesenteron, swelling on the left side, also on right side, complaint of a stitch in the side after running, languid and indisposed to talk, nervous and irritable. Now very important what he writes. Dear student, talks in his sleeves, grinds his teeth. કેટલા પેશન્ટમાં જોઈએ છે દેવાંશી? ડગલો દાંત કોઈ પીસતું ન હોય ને એવું છોકરું જ નથી હમણાં કોઈ બી. લાડ મોઢામાંથી ન પડે એવું કોઈ છોકરું દેખાતું જ નથી. તોય આપણે આ દવા તો કોઈ દિવસ યુઝ કરતા જ નથી. એટલી દુઃખની વાત છે, કેમ કે આપણે બુક્સ વાંચતા જ નથી. વાંચવાનું જરૂર શું છે? આપણા પાસે મોબાઈલ છે. Very strange, huh? Indurated and palpable gland everywhere. See what he writes. Indurated and palpable gland everywhere. Oh my God, what he writes. A drum belly. Oh my God. Tabla ugaadi sako, drum. Dad. Drum belly. Spleen region bulging out. Oh my God. Spleen region bulging out. That was one of the Burnett's clinical cases. That was cured by Burnett bacillinum. In most instances, I have informed he used the bacillinum in 200 potency. Believe me, dear student, 200 is the most efficient potency for bacillinum to be used in our clinical practice. તમે લોકો બધા પ્રેક્ટિસ કરવાના છો તો આ વસ્તુ તમારે પહેલા વાંચવી જોઈએ. આ કોઈ દિવસ વાંચતા જ નથી આપણે, કોઈ દિવસ નહીં. Repertory you should read afterwards. Read your Materia Medica. Open your eyes for Materia Medica, for God's sake. We have read 10,000 times this, n number of times. તમે આજે નહીં વાંચો ને તો કાલે હોમિયોપેથિક નહીં રહે, એ લખી લેજો તમે. If you are not sound with your base, no, the base will fall down. This is the base. These are the base books you have to read at any cost. Totally બાંધીને બેસી જવાનું વાંચવાનું એટલે વાંચવાનું. It is very, very important. Remedies you should never miss. And when Kent writes, he is the final authority because he has seen patients being cured. Now he writes about something about argentum nitricum. Now we'll jump to this ringworm. Oh my